Is this where we can leave the meeting?
Yeah, I see several attendees logging in now, so great.
So I'm going to give it another minute and then we will get started. Okay, out of respect for everyone's time, we are going to get started. Good afternoon, everyone, and thank you for joining us in the first of a three-part series on the role of lobbyists in shaping healthcare policy. I'm Rebecca Lunstroth with McGovern Center for Humanities and Ethics, and today's panel is sponsored by UT's Quality Enhancement Program titled Health Policy for Health Professionals, or HP Squared. Our aim is to enhance the health policy education of all of our learners. This is the first of many opportunities you will have to learn about how policy influences the profession you are training to go into. Please take the short survey that's going to appear now before and then after today's discussion. They are anonymous. Additionally, you are encouraged to pose any questions in the chat and that we hope to be able to get to you. That we hope to be able to address. Today's moderator is Scott Forbes, who is the Senior VP of Governmental Relations at UTHealth. In this capacity, Scott and the governmental relations team are liaisons to local, state, and federal governments. He assists in obtaining federal and state appropriations for the important biomedical research, healthcare, and educational missions of UTHealth, as well as advocates for statutory changes, and he works with federal and state agencies on important programs for our faculty, students, and staff. Previously, Scott was the governmental relations manager for the Port of Houston Authority and the assistant director for state and federal relations for 2 Houston mayors. Scott's a graduate of Austin College in Sherman, Texas, where he earned a BA in political science. And he was one of the college's inaugural exchange students with the Leningrad State University in the old Soviet Union, now St. Petersburg State University. On behalf of the QEP team, I want to thank Scott and his colleague, Kara Crawford, for helping to arrange these sessions. Scott, it's all yours.
Thank you, Rebecca. It's my pleasure to moderate this first panel of HP2. Today, we're discussing the legislative process and the role of lobbyists and advocates in healthcare policy. And we got a great panel to discuss this topic. Without further delay, let me introduce everybody alphabetically, starting with John Pitts, who is the founder and managing principal of the Texas Star Alliance. He has nearly 25 years of experience working around the Texas Capitol. John served as general counsel to the legendary former Lieutenant Governor Bob Bullock. He was also a chaplain for the Texas Senate. He has held several leadership roles in multinational law firms and has experience as an attorney and lobbyist that is well respected among policymakers across the country. John is a board member of the UTHealth Development Board and is chair of the Government Relations Advisory Committee and chair of its PAC committee. John is a graduate of Southern Methodist University, where he earned a BS, an MBA, and a JD. In addition, John has a Master's of Divinity from Virginia Theological Seminary. Yes, John is a lawyer, a lobbyist, and an Episcopalian clergy, a true Renaissance man. Denise Rose is a partner with Jackson Walker, and she's been working in and around the Capitol for about 2 decades, primarily on healthcare issues, but now expanded to other areas across the business spectrum. Denise provides effective strategic counsel to clients that include nonprofit organizations, nationally ranked hospitals, and Fortune 500 companies at the Capitol. Prior to Jackson Walker, Denise served as Assistant Vice President for Legislative Affairs at Texas A&M Health Science Center. She was the Senior Director of Government Relations at the Texas Hospital Association, Government Relations Liaison for Texas Children's Hospital here in Houston, and was a policy analyst at the Sunset Advisory Commission. She began her career at the Capitol as a health law legislative fellow for State Representative Vicki Truitt. She received her BS from the University of Oklahoma and her JD from the University of Houston Law Center. Thank you for joining us, Denise. Clayton Travis leads the Texas Pediatric Society's legislative and regulatory advocacy efforts. He communicates regularly with state lawmakers, state agency leadership, and advocacy coalitions. He mobilizes physician advocates to engage on issues related to child health and the practice of pediatric medicine. Clayton joined the staff of the Texas Pediatric Society in July of 2014 and has extensive experience advocating on behalf of children's health and mental health care needs. Prior to joining TPS, Clayton worked as a Hogg Foundation mental health policy fellow with Texans Care for Children, a nonprofit advocacy organization dedicated to improving the lives of Texas children. He has worked as a staff member in the Texas House of Representatives. Clayton holds a Master's of Science in Social Work from the University of Texas at Austin, and importantly, has a bachelor's degrees in Sociology and Religion from the great Austin College in Sherman, Texas. Go Roos. Albeit he graduated well after I did. Thank you all for joining us. So, to really start off this series, we don't want to have like a civics lecture, here's how a bill moves through the process and all that kind of stuff. I really think learning from your experiences and how they shaped your careers is going to be more beneficial to the students that have joined us today, more than a quiz lecture type thing. And any sidebars that you might have that would be interesting to students, please jump in. So I'm going to start the discussion with the first question. The Texas Legislature is a little lesser known than its cousin, the United States Congress. What was the most surprising to you when you started working in and around the Texas Legislature? And why don't I throw that first to Denise?
Thanks, Scott, and thank you all for having me. It's an honor to be here today. What was the most surprising thing? Well, I think for me, I was right out of law school when I started working in the Capitol, and I think the most surprising thing, and I think one of the things that I still like the most about the Texas Legislature is the way that people work together across the aisle. Bipartisanship still exists. I think maybe it's a little more challenging in these current times, but certainly it does happen, and I think is a really beautiful thing to watch.
Great, thank you. Clayton, why don't you take a shot at that too? What was the most surprising thing to you?
Yeah, well, thanks again for having me. I really appreciate being here. First, I'd start, starting off in my career was how quickly you can become an expert for members and their staff throughout the legislative process. It is amazing how many issues come before legislators throughout a legislative session and even in the interim. They have to tackle everything from water resources to health and human services to transportation and criminal justice issues. And it's just an amazing amount of information that these members are expected to have an informed opinion about and then create a judgment through their vote. It's a lot of responsibility, and they rely on members of the community. They rely on the lobby community. They rely on professionals in all walks of life to inform them on how best to make those decisions. And so if you become a well-informed, educated person on a specific subject matter, you immediately garner their respect and attention when it comes to that issue. And that's so it's very important for medical students, for physicians to realize the moment you walk into the Capitol, you know more about your given specialty, about the practice of medicine, about healthcare in our state. You know more about that issue than 80% of the people in that building. And in order to be effective, you need to demonstrate that, but also demonstrate that in some humility as well, because there's a lot of smart people in the building as well.
Right, be able to explain it where somebody that isn't involved in it can understand it. John, what was the most surprising thing to you when you started working in and around the Texas legislature?
You have to realize that I came to the Capitol from a church. And so it was a very different environment. I came in, as you mentioned a while ago, as the Lieutenant Governor's General Counsel. And one of the things, and so we're talking about a very different time than it is today. The people at that time were really working together much more than I think they are now, even though Denise is still seeing some of the bipartisanship now, and I do as well. But it was much more so then. They saw an issue and they went after it. The issue that I was involved in when I first got there was a water issue. And the legislation that I was asked to push was SB1, which was the water issue. And it passed both houses without any negative votes. And that was really it took working together and taking the lieutenant governor as well as the speaker to help guide that through. So the surprising is that they were working together. The other surprise is that, we're all used to what goes on in Congress, and that they're meeting year round, and that they were not meeting year round was a surprise to me. And then the other surprise was that they are meeting year round with the committees meeting, but that they're not meeting or an organized meeting during a legislative session year round.
Right, that's an important point, that the legislature only meets 140 days every 2 years. Now, some people say it should have been 2 days every 140 years, but those are some naysayers. What has been the most challenging part of working in the legislature? What is the thing that along the surprise, but something that other people would not realize is such a challenge of working in the Texas legislature? And why don't we start off with you, Clayton?
Yeah, this probably isn't surprising for the physicians listening, but translating scientific knowledge to proper best practice policy making is always a challenge, right? Identifying what solutions are and then translating that into policy is a difficult task. Like I said, members are part-time legislators. They don't know these issues in and out. They may be a lawyer in their day job, and then have to come and understand why it's important for the evidence base for vaccines. And then they have to balance that evidence base in their decision making with the political realities going on in their districts. So trying to strike that balance with members, help them understand, provide them the ammunition they need in order to defend best practice science is always a difficult task. Great.
John, you want to tackle that? What was the most challenging part of working at the legislature?
I think Clayton has hit it. There's so many forests that we have to go through in the legislature. To get through that forest is difficult to point out to a legislator. One of the things that has really been challenging to me is when the polls all show that the people of Texas want an issue, yet the members of the legislature do not go for those issues. And we'll get into some of those issues later, I'm sure. But that's always been a surprise to me. It was a surprise 20 plus years ago, and it's a surprise today.
Yeah, that's a good point. Denise, you want to follow with the most challenging part of working with the legislature?
Yeah, I would probably third that, just the translation of data and statistics to policy to people who are not always driven by those things. But then I would also add that I think it's really challenging to work the pace that we all work during a session. And it's not just the lobby, it's everyone in the building working sometimes 18 and 20-hour days, especially towards the end. It is very difficult to have a reasonable, knowledgeable conversation with someone who is exhausted. And I speak about myself when I say that too, but that it gets really hard.
That is true. Sitting outside the appropriations working groups on conference, and you're not allowed in there, and then they pull you in, at 2 or 3 in the morning and say, you need to answer this question without any context whatsoever of what they're talking about. It is definitely tough, and they're not exactly sympathetic to us.
No, and I remember one time that I had my Fitbit on and I had looked at the end of the day and I had walked 13 miles. And just ridiculous.
Yeah. So here's an obvious question given today, but it's probably one of the hardest to answer. What is a lobbyist? Who wants to take that difficult question first? How about you, John? You've been the lobbyist, I think, the longest. So why don't you tackle that one?
Well, I'll start with a story, and which will answer your question. I remember when a certain state senator was first elected, and before he was sworn in, he was coming to Austin for some of the committee hearings, and I ran into him in a hotel, and I was staying at the same hotel, and after the second or third time, we introduced ourselves, and he said, well, what do you do? And I usually don't answer that I'm a lobbyist, but I did that day, and he put a cross up and started backing away from me. And I said, oh, no, don't think of it that way. I said, I think of it as that I am an educator. And when I said that, the cross got even more pronounced, and he started backing away big time. He said, if you can convince anybody of that, you could sell anything. Well, the reality that state senator is still in office and chairman of a committee, and I believe he would recognize that definition today very well, because a state senator or state representative cannot read the number of bills that are filed, and so they depend upon their staff, but they also depend upon the lobby also to explain what these bills mean, both the pros and the cons of the bill. Good lobbyist explains both sides and lets the member understand what the bills mean. That's educating the member. I'll let the other two answer that their way also.
What do you think, Denise? Definition of a lobbyist?
A zealous representative of your clients.
That's
I think, I consider my role as an advocate just for particular issues or people.
Good. Clayton?
I'll get technical here for a second. So we think of, lobbying in the same vein as we think of advocacy, right? And then the way I see it is there's an umbrella of advocacy and then 2 tiers underneath. And the first is education, like John said. 80% of what we do is just talking about issues, explaining context to a certain sector, whether that's healthcare or education. And then the other side is literal lobbying, which has a definition, and it's basically telling a member or a state agency executive to vote yes, or really a member to vote yes or no on a bill, or yay or nay on an appropriation item. And that's what it comes down to. That is the definition of lobbying. But that only happens near the tail end of a certain spiel or pitch. And so again, a lot of what we do is educating members, but then of course our clients, in my case, pediatricians of Texas, have an opinion on how things should go. And it's my job to tell members that this is the right way to go if you want to improve health and well-being of Texas kids.
So interestingly, Kara and I are not registered lobbyists since we're state employees. And one of the drawbacks of that is that if we go into a member's office, we actually cannot say support or oppose a bill. We can educate and inform, so we can say the world stopped turning on its axis if you pass this bill, but we're not going to say we're opposed to it. There's a little fine line there, but it's interesting with state agency and higher education institutions not able to say support or oppose, but we relied strictly on the education side of that equation. I mean, we could tell them our needs and stuff like that, for instance, for appropriations and stuff like that. So it's a little different twist on a traditional lobbyist.
And to my point, y'all are still very effective because education is the majority of the job.
Right. So coming back to you, John, a lawyer, a lobbyist, and a priest walk into a bar, and they were all you. For all three of you, how did y'all get into lobbying? What was the thing that attracted you to the profession, and what steps did you take to actually get there? John, we'll go with you first since I picked on you.
In what hat do you want me to answer that question? My father was the general counsel of his company at this time, and in that role, he was also head of the lobby team. And he introduced me to the lobbyist, and I liked them. I mean, they were just nice people, and I went to a couple breakfasts with them, and that was fun. Actually, you know, the typical thought is that lobbyists just have fun and take people to dinner and lunch and all. That's not necessarily true, obviously. But I thought that might be something that I would be interested in doing, because the lobby is a people person field, and I like people. And I think that's something that people that are looking to as lobby as a profession should be very aware of. It's a people person field. And so I went to my father and I told him that I was thinking about wanting to be a lobbyist when I grew up. And he looked over his glasses and told me, he said, "Low ambition, son." And so I put it to the side. Needless to say, we all want to get the approval of your father. And then later in life, I was on a board of directors, and Rusty Kelly was our lobbyist. And I was really impressed. And Rusty Kelly is a lobbyist, for those that are listening. And it went through my mind again. And then when I was on staff with Bullock, working with a whole lot of lobbyists, I decided that is what I wanted to do. And so when I left his office, I went with a law firm and became a lobbyist.
Did your brother have any influence on that?
Not at all.
Not at all.
He and I started as a lobbyist the same year he went into the legislature.
Oh, okay. I didn't realize that y'all didn't overlap at all.
No.
Just
We overlapped, but we did not. We started at the same time.
Got it. Okay. So John's twin brother was a state representative and worked his way up to being chair of appropriations at one point. Clayton, how did you get into this business?
Sure. So haven't been in the business as long as my esteemed colleagues here, but it basically started when I worked as an AmeriCorps Vista volunteer at a youth homeless shelter. I knew I wanted to go into social work after that, to create system change, to improve the lives of people in Texas, to help those who are disenfranchised, but realized quickly that I wasn't a very good clinical social worker. I got too frustrated by the systems around me that limited what we could and couldn't do and how we could get help to people. And so realized I needed to go upstream. I needed to start tackling bigger problems to create systems change at a larger level. And so then went on to receive my degree in social work from UT, but as a part of a policy track, if you will, knowing full well that I wanted to get involved in advocacy to help influence policy, to again change systems in both health and human, and basically the health and human services sector. So was lucky enough to get an internship in the Texas Legislature, and then from there worked on policy issues to improve kids' health at Texans Care, and then have moved on from there. And the requirements of the job to be as effective as you can be is to become a lobbyist. And so that's why I'm here, to hopefully improve the health and human services sector of Texas in this capacity.
Wow, that's great. That's great. Denise, how did you get into the business?
Interestingly, I was kind of had the same background as Clayton. Was interested in healthcare and policy. I was also an AmeriCorps Vista volunteer, go figure. And then went to law school with some of that still in mind, but not really a thought of I want to become a lobbyist. It wasn't really until I got to the Capitol. And I think for me, it was driven a lot by the people that I met, the people that came into our office, who I thought were incredible and doing really good work. And it was people at the Texas Hospital Association and people that were working on healthcare issues. And I thought this is a place where I can go and work on policy and feel like I'm making a difference in this space as well.
Great. So this is kind of an off the wall kind of question, but do any of y'all have a personal motto that you use as you're going through your lobbying affairs, like, must be present to win or something like that? Why don't we start with you, Clayton?
I wouldn't say I go around shouting this everywhere I go, but one thing I have learned very quickly at the Capitol is basically to be kind and work closely and give benefit of the doubt to everybody you meet, because you never know where they're going to go. We've had plenty of examples of low-level staff members in offices become state representatives. We've had examples of those same staff members becoming high-powered lobbyists themselves. And you, again, working with everybody, giving everybody the benefit of the doubt and treating everybody with kindness and respect throughout the building is a key element of doing your job correctly, because there's so much transition. One session they could be in this role, and the next session they have your bill in your hand and have every option to kill it if they want to. So making sure that you are doing what you can for everybody, regardless of their title, regardless of their political affiliation, is key.
That's key. Senator Clayton was a Senate page at one point. I think they say he's the first page to become a senator. So that goes right to your point.
My first supervisor at the state capitol is now a colleague and lobbyist friend of mine. So, everything's connected.
Yeah. Denise, how about you? Do you have a personal motto?
I use the wise words of the Godfather. It's not personal, it's business. Just to not take anything to heart, or at least try not to, because it's usually not about you at all.
Right. That's a good one. Mr. Pitts, do you have a personal motto?
Very similar to Clayton. Be nice to everyone. And that's from the janitor to the speaker, lieutenant governor, and the governor. As Clayton was saying, you never know where that low-level staffer would be. He or she may be Speaker of the House the next session, or the next not too many sessions afterwards, as we are experiencing right now.
That's right.
But everybody can be your colleague, and everybody can help you in your endeavors. And you want friends any place you can get them, and people really want to help you at what you're doing at the Capitol, and that's from A to Z. And when I'm saying that, from the top to the bottom of the employees and the people that work at the Capitol. And but the Capitol is a very small fraternity, and if you do not treat someone with respect, that word gets around very, very quickly, and then you're dead. And the worst thing that anyone can do at the Capitol as a lobbyist is not to tell the truth. And because that word really spreads like wildfire. And I ended at that. I was going to add something else, but I will not.
Yeah, I like to say, all you have is your reputation up there. If you become someone that people can't trust, so act accordingly.
Yeah, that's your one cash is your reputation and your ability to be a straight shooter. And if you're right, both of y'all are right. If you lose that, you're not going to be a lobbyist for long.
It's very hard to repair that reputation. And because the word has gotten around so quickly and it's gone around the Capitol so fast. The only way to repair it with some of the members is if you have some very high profile clients that can put in a lot of money into that legislator.
Right.
That doesn't always work. That's what I was going to add while I go and pulled it back. But I decided to go ahead and say it.
So building on something that John said earlier, and go to Denise now. I get asked, I say I'm a lobbyist, and people say, really, is that good for society to have lobbyists? Is it bad? What is your opinion on whether it's good or bad? And usually what I say is, do you like puppies? They look at me funny, and I was like, well, puppies have lobbyists. And we actually have a puppy lobbyist with us today. And Denise, she represents, so what is that called again? The Best Friends Animal Society is one of her clients. So we actually, I've used that quite often, and it's usually very effective. But now for the first time ever, I actually get to introduce a puppy lobbyist. So Denise, why do lobbyists get such a bad rap? And is it justified?
I think, with any profession, there are always going to be bad apples, and that's impossible to avoid. And so you're going to find any place, unfortunately, people that are unethical and people that are, not playing by the rules. And anyway, but I think for the most part, those are the exceptions, not the rule in the Texas lobby world. I find that I really like most of the people that I get to work with in the Capitol. And I do think lobbying matters. I think that we all bring a very unique skill set to these jobs that allow us to figure out a way to translate a message to members in a way that they can digest and that we know that they'll understand and that will matter to them. And I think you have to know your way around the political and legislative process and know the people in order to be able to do that. And I think it's naive to just think you'll walk into a building and know exactly who to talk to, because in any given situation, there are about 1 million dynamics at play, some that you know about and some that you don't, some that you find out later. And, a specific example I'll use is a few sessions ago, I was working on a bill that got stuck in a committee. And it turns out that we found out later, the chair of that committee had decided they were not moving any of this individual's bills because of a vote they had made earlier in session on something. It had nothing to do with the bill we were working on, with the policy at hand. It was very specific to an interpersonal issue with those two people. And sometimes we know about that and can figure out ways to navigate around and help our clients navigate around them. And I think that those are the things that we can bring to a group, an association, an individual client, a business, to help them be more effective at accomplishing their goals.
That's good. So building off of that, Clayton, when Americans are polled about the most respected or highest ethical jobs, our students' professions, doctors, nurses, other healthcare professionals, always rank in the top 5, if not right at the top. Gallup poll puts lobbyists somewhere below used car salesmen and pawn shop brokers. Well, how do you overcome some of these unfair characterizations of the profession, as Denise started touching on, and the value you add? But when you're talking to your pediatricians and they look at you side-eyed as a lobbyist, how do you address that?
Yeah, that's a good question. First I'll say on that, the trust poll that you talked about, physicians are definitely up there. Pediatricians are at the top of that list. So I will put my clients there as a great example there. And of course, one of the things I do when I introduce myself to new members or in discussions like this is not only that I'm the lobbyist for pediatricians, but because of the ethical obligations of the profession of pediatrics, I'm the lobbyist for kids. You know, my 90% of what I do is all about lobbying on behalf of child health and well-being. And so right then and there, we have a connection. And, you know, yes, lobbyists get a bad rap, kind of like lawyers do, because those professions represent everybody, right? That everyone has a lobbyist. If you are part of an association through your profession or through a club or a hobby of some sort, you most likely have a lobbyist of that group of individuals, just like everyone is due a lawyer within the judicial system. And so because of that, everyone, including from your perspective, who you might think is bad or pushing bad policy, has a lobbyist or lawyer as well. They get a bad rap because people who you disagree with are being represented by somebody. But that's just how the system works. Everybody needs technical expertise in the judicial system with lawyers and technical expertise in the legislative process via lobbyists. And that's why it can be sometimes a divisive profession. Now, again, most of what we do is education, but of course there is the added component with lobbyists that there's money involved, right? A lot of lobbyists provide funds through the campaign process. And again, that's a part of the process as well. You know, it is an expensive task to run a campaign. And so members do need help in that regard. And creating trust by instilling, you know, a back and forth relationship via campaign funds is a part of the process.
Great. John, one of the questions we've already gotten in the chat is, what are the ethical bumpers for lobbyists? What, you know, we have the Texas Ethics Commission. You might want to describe a little bit, you know, Clayton talked about it a little bit, the money being added in through politics, and, you know, there is the whining and dining and stuff like that. What are the ethical boundaries that are established in the state of Texas?
I want to answer that question that you asked, but I also want to tie into what Clayton just mentioned too. It is, and you're right, Clayton, what we really do walk a fine line when you bring in the money and all to it, which is responding also, Scott, to what you're saying. But we are educators. As you said, most of our work is as an educator. You know, the media does not help us because they refer to us as a special interest. The legislators during a legislative session do not help us because they also refer to us as special interests. The problem is that once the legislative session ends, all of that language from the legislators ends, and we're getting telephone calls for money. And so it's, you know, we're the best friends and we're the butt of jokes at other times. And so that's I'm speaking very straightforwardly. That's a very frustrating thing from my standpoint, is that we're listened to and but we're also referred to as a special interest. But the Ethics Commission and the legislature has put in special rules or bumpers, as you said, on what we can do and what we can't do and what we have to report. First, as lobbyists, we have to report that we are lobbyists and what we are, our ranges of what we are being paid by our clients. And we have to do that once we start representing a new client, we have to register that. We also, any money that we spend on a legislator, we have to report that. And so there are some rules that we that can expose, that are make transparency really possible. Also, if we find ourselves representing two clients that their issues are opposed to each other, we have to actually offer to resign from both clients and notify those clients that we have an issue that are conflicting with each other. So there are rules that we adhere to make sure that those that we are both transparent and adhering to ethical standards.
That's good. Thank you. Clayton, let's jump to a different kind of question. And this one is probably going to be a little bit more obvious for our audience than the other two panelists, but kind of describe how your client fits into the healthcare policy world, not so much what their policy needs and wants are, but more like how does the legislature and agencies impact pediatricians?
Yeah, good question. So again, just to clarify my role, so I'm the Director of Advocacy with the Texas Pediatric Society. We are the state chapter of the American Academy of Pediatrics. So we have a membership made up of over 4,700 pediatricians, pediatric subspecialists, and medical students, many of which may be on the call. It's my role to represent them and the issues that they care about. We insert ourselves into a lot of different conversations because pediatricians are experts in a lot of ways on child health, but also child well-being. And that includes, for instance, weighing in on foster care and child abuse issues, weighing in on education issues that impact health, weighing in on obviously some of the bread and butter things like the Medicaid and CHIP program, so low-income health insurance for kids, and immunization best practices, even though it's, despite it being extremely polarizing right now, pediatricians have been talking about immunizations forever now. It is our bread and butter and things we will always stand behind. We like to insert ourselves into a lot of different areas. We joke that pediatricians care about a lot of different things. And so our expert technical assistance can be available to members on a wide range of issues. And again, we try to bring the evidence and the science that comes along with our determinations and our policy recommendations as well, working closely with national groups like the AAP, working closely with our colleagues over the Texas Medical Association and other specialty societies like the OB-GYNs. And then of course, colleagues at, like, for instance, like the hospital associations with Denise and whatnot, where our physicians are working and are employed by, such as you, Scott, at UTHealth. So we like to collaborate a lot with all the entities of the healthcare sector to make sure that our recommendations are being taken seriously and being promoted by all those around us. But then also working closely with child advocacy groups. There's a lot of like Texans Care for Children, my previous employer, work a lot with foundations to kind of research best practices for child health and well-being in a lot of different areas, whether it's juvenile justice or mental health, or foster care, like I said. So providing ourselves as a technical expert in those areas is really helpful. And then, like you said earlier, physicians are trusted in their community, but also at the Capitol. That's why you're never going to see me up there testifying in front of a bill. You're going to see a physician, a member of ours, up there testifying again for or against a bill. Our doctors are seen as experts. They are seen as compassionate community leaders, somebody who has the respect of not only of members of the legislative community, but of their community, which are voters for that given legislator who is being represented and making decisions. So I feel like not only do they have the technical expertise to influence legislation, but they have the leadership skills to do so as well.
Right. So shifting to Denise, Clayton has basically a single client of pediatricians. Shifting over to you and John, how do you handle when you have multiple clients? How does your clients fit into the healthcare policy world, and how does it affect your clients?
So I represent a number of clients, mostly on the provider side of the healthcare equation, hospitals, long-term care, home health, the occupational therapists, and a couple of different pharmaceutical companies. I'm not sure I'd put those in the provider space, but and I think, generally we're looking to ensure that all of these providers are paid appropriately and fairly by the state Medicaid program, that regulations are appropriate, not heavy-handed, not making it harder for them to practice and take care of patients in whatever setting they're in. And I think that I feel really privileged to get to represent these different types of entities, to see all of the different parts of the healthcare spectrum. And each area is really unique and really complicated. Like we were saying earlier, coming to talk to members about, these very specific and weedy rate issues, you really have to have someone who has been living and breathing those issues for a long time. And, we're talking about also the spectrum of from birth to death and on some of these issues. You know, hospitals take care of newborn babies and they take care of people at the end of their lives. And there are so many things that come in between all of that. And so, you know, my role is just generally ensuring that their voice is heard, that they have a seat at the table, that they're represented, and that members and staff are aware of the nuances that they face and the challenges, and that hopefully can be addressed.
Perfect. John, you want to add to that? How your clients are in the healthcare policy world and how it affects your clients?
You bet. As Scott and Kara both know, that one of the things that I've been working on for the last 2 legislative sessions is Medicaid expansion. And I have a number of clients from different angles that have been working with me on that issue. One is Greater Houston Partnership, trying to get the business community very involved. And by the Greater Houston Partnership representation, getting the business community all across Texas involved. And also several foundations that are health related foundations, and getting the expertise from those foundations to on this issue. But what we try to do in most big issues is to try to bring a collaboration of a number of different groups. You mentioned Texans Care for Children a while ago, Clayton, and they've been very, very helpful. And the more people that can get involved, and that's more people on the ground, more boots on the ground at the legislature, and more people that can weigh in with the expertise. Again, as Clayton mentioned, and then they have the expertise and they can be listened to better at the Capitol. That's how we typically work at Texas Star Alliance, and how I typically work is to try to get more people involved and get a coalition. I think that, you know, we've got a real chance of expansion through Build Back Better in Washington. If that passes, it looks like Manchin is not opposed to the Medicaid portion of that. I'm not sure I am answering your question, but I am lobbying now people to help us in that, to get as many voices as possible to be involved in that work as it is in Congress, but as it will come back to Austin in some way. I'm afraid I hope it does not get to the Attorney General's office and comes to the legislature instead.
So we're gonna shift to, we're getting quite a few Q&As from our audience. And so, but before we shift totally to the Q&A we're getting, can you briefly give some advice on how our students can be involved in policy-making decisions that impact their professions? Let's start with Clayton. Well, actually, we started with you first. Let's start with Denise. Denise, how can our students be involved in the policy-making decisions that impact their professions?
Well, the first thing I would say is make sure you're registered to vote and vote. That's really important. And I think just staying engaged and paying attention to what's going on. And, you know, if there's something that you think should be changed, just concerns you, you know, things like that. Know your government relations professionals that are sitting here, Kara and Scott. They're amazing. They are incredible advocates at the Capitol on behalf of this entire institution. They are people that you can go to with questions and share your concerns. And I think joining professional associations like Clayton's, if you've got a specialty in pediatrics, or there are professional associations for every type of medical specialist, I think at this point. And they also make sure that you all have a voice. And that's true for allied health professions as well. The OTs, for example. So I think just making yourself aware of what's going on around you, how it impacts your job, how it impacts your patients, and then taking the steps to to be engaged is really important. If you're not at the table, you're on the menu. That's another famous Capitol saying.
That's right. That's one of my favorites. John, how about you? You got any advice for our students?
Well, I think that Denise started exactly right. Vote. It's amazing how many people do not, and how many people in the age group that we're talking to today do not vote. Do not vote not only in the general election, but do not vote at all in the primaries. In many of these elections, the election actually occurs in the primary. And so not only do you vote, but before you vote, to get information about who you're voting for. That's number one, to be able to vote, and then really become knowledgeable. 20 years ago, I would have said, read the newspaper, but just read the newspaper online, read as much as you can about an issue. I mentioned Medicaid expansion. Read about that as much as you can. Become, as Clayton said, an expert on some of these issues that you're interested in, and then communicate. Get to know your state rep, get to know your senator, and I mean that, really get to know them, knock on their doors, not on their home doors, but on their district doors. You can find out their office address very easily. Right now, there's nobody in Austin, so you go to their district offices, which for us right now would be in Houston, or if you're at home at all, go to their district office in your district, in your hometown. But those two things, I think, are really the best thing to do as an advocate for an issue that you're interested in. I say Medicaid expansion again. Your careers will be enhanced greatly if we could get Medicaid expansion taken care of. Denise mentioned earlier about wanting to be sure that the providers are well compensated, and that's how it's going to happen, is through Medicaid expansion. The people that are sitting in your offices, waiting rooms, are going to be there. A lot more of them are going to be able to be there that are going to be able to pay you in the future if we can get Medicaid expansion. I could go on and on. You can tell that Medicaid expansion is my passion. But those are the things.
I completely agree. I appreciate the lobby on the call about Medicaid expansion. So the only thing I would add, because I completely echo everything that's said. Number one, vote. Number two, get involved in your association. Who represents you and your profession at a large degree, whoever that is. Three, meet your state representatives. Every citizen has the right and capability to go and meet your state rep. I saw a question in the chat that basically said, well, how do I do that? And the quick answer is call the district office, introduce who you are, highlight that you are a physician leader or medical student in the community. You provide this amount of care for this amount of kids. This is why I'm important, basically. And then say, I'd love to meet. Can they get together for a coffee? Can they get together for a breakfast? Can I just drop by the office and talk about a few issues? And then talk with Scott and Kara to figure out what those issues are. If you're interested in a certain degree, talk with your association to figure out what the policy context, if you will, so you're not suggesting something that's been shot down 10 times in a row already, and then have that conversation. And again, that needs to happen now. We are in the interim, which is the relatively slower time than session. If you walk in cold during session while everyone's running 100 miles an hour, you're going to get ignored because you haven't built up that relationship over time. And that's what's required. Your goal as a physician leader, as a health systems leader, is for a state legislator to have your cell phone number, that whenever they get an issue brought to them that they have no idea how it works, they give you a call because they know you're an expert. That's where you want to be eventually. And so that's why I try and tell our pediatricians, meet now during the interim, create that relationship, get involved in the political side if you're interested in that. But if not, you can still be a policy expert, a science expert, and be of value to them. And the last thing I'll say is once you do join that association, get involved in the policymaking process. There's a whole process to influence what I'm supposed to say at the Capitol, and it needs to your voice is a part of that. So thanks.
Remember that that Gallup poll says that you're the most respected.
That's right. So going off some of the questions that we've gotten here, let's see. what are opinions? Oh, I'll skip that one. How about this one? Are there limits to what lobbyists can spend? Any of y'all?
Yes.
What are your opinions on taxpayer-funded lobbying? Yikes.
I'm a taxpayer-funded lobbyist. Can I answer that question?
Yes, you can definitely.
I represent a city, and I think that governmental entities, and we're part of this panel as a governmental entity as well. Everyone deserves to have a voice at the Capitol, and I think that there are ways, and if the constituents of a place decide they don't want that to happen, they can change policy at the local level. But a blanket prohibition on that, in my opinion, is not a good idea. A lot, think about Texas and think about the geography of this state and the population and demographics of this state. I don't think it would be wise to have one policy for every single city and town. There's so many unique issues. And like we've said, some of these members, they may not be aware of the environmental impact of the new development that's going in on the northeast corner of town. And that's some of the role that we can play, talking about how a bill that somebody filed impacts a particular area.
And let me add to that, Denise, as I sat through some of the hearings on this, because I represent 5 taxpayer-funded entities. A city councilman came in from someplace far north in the Panhandle, and he sat in the hearing room all day. And he was finally called upon at 2 o'clock in the morning or 1 o'clock in the morning. And he had sat there all day. And so 1 o'clock means he has to spend the night, spend the money to spend the night, and go home the next day. He has been away from his day job all day. He's been away from his responsibilities as a city council member all day and all the next day as well, because he's traveling. If he had a lobbyist instead, that lobbyist could have been reporting to him all day instead of having to sit there. It's just much more efficient if they have somebody that represents them in Austin. And typically there's an association, as Clayton has mentioned about an association. There's an association for the cities that is very efficient for that association to be able to represent a number of different cities, for instance, and be able to report back to all of those cities. So I'm an advocate that we continue to have that, needless to say, and it's to my self-interest, so I'll say that too. And right before I got on this call, I was talking to one of my school districts that I represent to help them out on something. Sorry.
So as a former city lobbyist for the city of Houston, I totally concur with y'all. The difference between the city of Houston and Cut and Shoot or Mule Shoe or Dallas, for that instance, they're totally different forms of city government in Dallas and Houston. And to have a blanket statement on what all cities should look like and do and everything is unreasonable. So another question. So I'll start with Clayton here. It's about scientific advice. So you present scientific advice, and I think this goes towards what John was saying earlier about them heating polls and not heating polls. So you got something that is absolutely shows a favorable poll throughout Texas, but yet the legislature doesn't act on that. Similar with scientific advice and evidence. Why doesn't the legislature absolutely heed that scientific advice?
Good question. I would say it's twofold. One, political reasons is kind of what it comes down to, right? Yeah. What is going to get me reelected and what is going to make it harder for me to get reelected? Again, like John mentioned, most of the outcomes of these elections happen in the primaries. So for instance, a Republican a Republican incumbent is going to quote unquote get primaried by a more conservative member because of the votes or stances they took, which are by our accounts very scientific in nature, follow best practice evidence, etc. But in a small bubble of the Republican world, may get them in hot water for infringing on a personal freedom, for instance. And that is, of course, a giant no-no in that fringe side of the Republican Party, and could cause them problems in the primary. And the first thing they need to do to keep doing what they do is to get reelected. So that's what it comes down to. Another part of that is implementing best practice scientific recommendations aren't always easy. And this is not a partisan part of the equation. It's just a reality and a logistical issue. So while we know that, this course of action is the perfect way to keep every Texan healthy, well, how do we pay for it, right? How do we implement it equitably? How do we ensure that there's no favored special interests, for lack of a better term, because I do hate that term, that gain, a foothold in the industry over another one. So there are just a lot of policymaking is a difficult task. And while something seemed obvious to a scientist who just looks at the data and comes with a reasonable conclusion as to what should happen, it's not always easy in the mechanical implementation of a given policy. And so I would highlight those two areas. One is just political partisanship, and you have to work around that. You have to give the member ammunition to protect themselves from that backlash if they're making a hard vote. And then it's just implementing a policy when the money doesn't exist, or when we have a 28 million person state to take care of, which is a hard thing to do. And I don't think that we give, as lobbyists, as citizens, give enough credit to the amount of creativity and ingenuity that's required to implement major policy decisions that are required sometimes.
So unfortunately, we are out of time. So I want to really thank John, Denise, and Clayton for volunteering to provide their insightful comments. And I'm going to try and go through the chat and pick some out and maybe answer directly through that. So we left a lot of questions on the board. Really appreciate you being involved. We're going to pop up those survey questions again and for the students to answer. And we're going to have another one of these panels coming up on, I believe it's April 8th is the next one. Yes, April 8th, and that'll be moderated by Kara Crawford, so I can sit and watch the chat box instead. I'm looking forward to that. Then we're going to have one in September on September 23rd. Both of these will be from noon to 1. Appreciate it. And I'm going to kick it back to Rebecca. Thank you.
Scott, Kara, a million thanks. Folks, I am absolutely just overwhelmed with all you had to share with our audience. And again, I echo everything you said. Students, get engaged. That is, vote and get engaged. And if you have any suggestions for additional panels, please reach out to me. And again, my heartfelt thanks to our panelists and to Scott and Kara for arranging this. So with that, I hope everyone has a wonderful and safe weekend. And again, join us again for our additional panels.
Thank you all so much.
Thanks, y'all.